the average, say, 65-year-old person in this country
Right.
is on how many drugs?
About 7.
7.
Yeah.
And not just intermittently, but like over
Chronic.
years.
Chronic. 90 plus percent of funding for medicine dollars is around chronic lifetime.
So
It's more recurring revenue.
So describe what that looks like the scale of it.
Yeah, I think again, we're so desensitized to this, we don't understand how crazy it is,
right.
how much of a failure it's been. Well, I'll give you an example. My mom. So my mom was 71 and went, for a checkup and was told by the doctor she was healthy. And she was actually at the time on 7 lifetime medications. So she was on, maybe a decade before, had high cholesterol, was prescribed a statin. And the message from the doctor was, no problem. Most, the majority almost of people your age are on a statin. No problem. That's a rite of passage. Then she had high fasting glucose. Again, that's basically prediabetes, which majority of people have. Metformin, one of the most prescribed drugs in the country, high blood pressure. So she has these comorbidities that are almost seen as like rites of passage. It's a rite of passage for a man over 40 to be on a statin. The majority are. So these were all kind of normal things. So as we've treated everything in silos, that's a lie. Heart disease, diabetes, in many ways depression, Alzheimer's, they're branches of the same tree. We've actually lied, saying those are different conditions, seeing 4 different doctors for 4 different treatments that don't even talk to each other. So we're managing the symptoms instead of seeing those symptoms as a gift and realizing that we have a root cause metabolic crisis. That's why the more statins we prescribe, the more heart disease goes up. The more metformin we prescribe, the more diabetes goes up. The more SSRIs we prescribe, which are now 25% of women.
The higher the suicide rate goes.
We're seeing skyrocket. So we're siloing everything. And literally...
Wait, so there's so many questions.
Yeah.
So 25% of women are on SSRIs?
We have a societal dynamic where 25% of women in the United States are on a medication. And I'm not just flatly anti-drug, but this is a societal dynamic, Tucker. We have 25% of women taking something that fundamentally numbs you out from reality. And we don't even blink an eye at that. And depression, mental health disorders, anxiety, suicide. Suicide is now the second leading cause of death for young adults. SSRIs are
after drug OD.
Yeah, and which I think could be related. And SSRIs, you talk to any high schooler now and looking in it, it's the first line of defense. I mean, it is prescribed like candy when
to children.
Oh, yes.
SSRIs.
SSRI prescription rates are skyrocketing among teens. You talk to any high school counselor, anyone at any high school, this is the first line of defense when a child...
I would never talk to a high school counselor under any circumstance.
Yeah, well, that's very smart. They're skyrocketing among kids, and there's actually a black box warning on SSRI's label actually saying that it increases suicidal ideation among children, and they're widely prescribed to children, not to mention the fact that 20% of high school seniors are on essentially methamphetamines, Adderall, which if you read the book Blitzed, actually traces the history. Adderall was developed by Nazi Germany as a tool for Nazi soldiers to be more aggressive, and now is prescribed widely along with SSRIs to kids.
One thing, I'm trying to keep track of everything you're saying, all of which is checkable, I assume, on the internet. Statin drugs are prescribed to the majority of American men over 40?
The last rate, I think 2019, the last study I said was 45%, and I think there's reports that now post-COVID it's close to 50%.
So what's the downside of statin drugs?
Oh, there's wild research coming out. I mean, the highest level, just even if the drugs don't have no side effects, heart disease isn't a statin deficiency. What statins, to me, at the most important level, represent that we have a moral hazard, right? Fundamentally, when you're prescribed that statin, you're told by the doctor that you're doing something. When you're prescribed the Ozempic, the doctor, Fatima Stanford on 60 Minutes, who's paid off doctor from Ozempic, said, throw willpower out the window. This is a brain disease. Food isn't the problem. It's a medical issue. Take Ozempic. Do not worry about what you're eating.
This is exactly what Purdue Pharma said about pain.
Yeah. So you have these messages. You have the statins. You're doing something. You now can eat what you want to eat. You wouldn't even believe this, but until 2018, and Dr. Robert Lustig, who's a hero of mine, has pointed this out, an endocrinologist at UCSF, the American Diabetes Association said that as long as you take your medications, you do not need to change your diet as a diabetic. So you literally have guidance from the American Heart Association, from the American Diabetes Association, now from the obesity industrial complex, saying that if you take these drugs, you're good. But that's a lie, because there's never been a drug in American history for a chronic condition that has lowered the rate of that chronic condition.
What's the cost of all that? Just diabetes?
Well, with diabetes, this is the root cause. Again, it's a misnomer to see this as an isolated condition. Almost 100% of people with Alzheimer's have prediabetes or diabetes. Diabetes is one of the...
Seriously?
Alzheimer's is now called type 3 diabetes. The most highest indicator you can have for dementia or Alzheimer's is some kind of blood sugar dysregulation. If you have normal fasting glucose levels, your chance of having any type of dementia is very, very low. Dementia is highly tied. Again, I don't even like using the word diabetes. Our cells, diabetes is cellular dysregulation caused by our environment or food. Again, the majority of people in this country have some form of that happening inside their bodies because of our environment, and this is unprecedented. So diabetes is really the root cause. But if you just take diabetes, this is one of the biggest line items in the U.S. budget. We're spending, if you add up all the line items we're spending on healthcare just to manage diabetes, it's more than the defense budget.
We spend, the U.S. government spends more managing diabetes than it does on defense?
What is going, if you want to stack rank what would bring down the American Republic, it's not, marginal rates of military spending. It's not, what the marginal tax rate is. Our biggest line item in our budget, the biggest part of our economy is healthcare, and it's also the fastest growing industry. Healthcare is the largest and the fastest growing industry in the United States. The bulk of that spending is coming from government, and as it grows, it produces worse results. It is not slowing down. It's going to be 40% of the budget in about 15 years, and it's only growing. There's nothing stopping this trend. And as that's happening, we're becoming an infertile, depressed, sicker population at an almost exponential rate. We're going to cease to exist as a country because we let that happen. And you look at the budget and you look what's really going to destroy the budget in our country. Defense is a small part of it. It is healthcare costs. It is metabolic dysfunction.
And is diabetes the biggest?
Diabetes and prediabetes is the root of almost everything. You have very few people with heart disease, with many forms of cancer, with dementia, with all these. This is the lie that's being told. When my sister graduated Stanford Medical School, she had to choose between 42 specialties. She was a head and neck surgeon, and then the fellowship was going to be even a smaller part of the body, 1 millimeter of the. That's what doctors devote their lives to, like literally a millimeter. That's a lie. That's a lie. When she was cutting out sinus inflammation, right? She looked at a patient's report. They had 60 pages. They had prediabetes, they had depression, they had heart issues. She didn't speak to those doctors. And she was never trained how the inflammation that she's cutting someone's face open and taking out, not once at Stanford Med School was she trained or even brought up why that person has inflammation in the first place. That surgery, Medicaid will pay $20,000 for that, along with all the other comorbidities the patient has. We're training doctors, right? Medical schools, pharma companies, hospitals, doctors, nurses, insurance companies. They make money when people are sicker for longer periods of time. The way to do that is to silo conditions. That's why Ozempic is so important, because obesity is not a siloed condition. Obesity is a visible example that we are losing our way as Americans, and treating that in a silo is just medically not going to work, and it's happening because of corruption.
Hey, it's Tucker Carlson. The internet is crowded with interesting things that don't really matter. On TCN, we attempt to bring you interesting things that actually do matter, and a lot of them. Interviews, long form and short, videos, documentaries. You can find all of it on tuckercarlson.com, and we hope you will.